Okay, so now we're going to talk about the axial skeleton in recording number 2. The axial skeleton forms the longitudinal axis of the body. It contains 80 bones that are subdivided into the skull, which will contain 8 cranial bones and 14 facial bones. The bones associated with the skull, 6 ossicles or ear bones, and the hyoid bone. Bones of the thoracic cavity or cage, which will include 25 bones, essentially 12 pairs of ribs, which is 24, and a sternum, which is your breastbone. And bones of the vertebral column, which are your vertebrae, and there are 26. Functions of the axial skeleton will support and protect the brain, spinal cord, and organs in the ventral body cavity, provide surface area for the attachment of muscles that will move the head, neck, and trunk, perform respiration, stabilize elements of the appendicular skeleton, will also house the brain and sense organs. And here is an adult skull. Here we're looking at an anterior view, so this is a front view. Here we're looking at an inferior view, so this would be if you were to take the skull and turn it upside down. And here you can see we have the parietal bone on the sides here, nasal bone, ethmoid, temporal, inferior nasal concha, nasal septum, frontal, sphenoid, palatine, lacrimal, zygomatic, maxilla, and mandible. So the frontal bone is going to form the forehead and the roof of the orbits or the eye sockets. The supraorbital foramen or notch, this forms a passageway above each of the orbit for blood vessels and nerves. The frontal sinuses, these are air-filled cavities above the orbit. They're lined with mucous membrane. They connect with the nasal cavity and they reduce the weight of the bone. The parietal bones, these are paired bones located posterior to the frontal bone. They form the roof of the superior walls of the cranium. They interlock along the midline of the cranium, forming the sagittal suture, and they articulate with the frontal bone along the coronal suture. And by the way, a suture is going to be, it's essentially a joint between 2 cranial bones. The occipital bone, this forms the posterior and inferior portions of the cranium. This will articulate with 2 parietal bones at the lambdoid suture. This is essentially the back end of the skull. There are some key bone markings of the occipital bone. We have the foramen magnum. This is a passageway surrounding the connection between the brain and spinal cord. It's essentially a big hole at the base of the skull that will allow the spinal cord to pass through from the brain. Occipital condyles, these are rounded surfaces on either side of the foramen magnum. They articulate with the first vertebrae. The temporal bones, these form part of both sides of the cranium and the zygomatic arches. They articulate with the parietal bones at the squamous suture. They will house the auditory ossicles in the middle ear, and key bone markings include the external acoustic or auditory meatus, the mandibular fossa, the mastoid process, and the styloid process. And here we can see, looking at some of these bones, here's our frontal bone. Here we have the ethmoid in green. This is the sphenoid in purple here. Here's the temporal regions, and then the occipital will be the base. This is looking at, if you were to take the cap off, looking straight down into the skull. The sphenoid bone forms part of the floor of the cranium. It acts as a bridge uniting the cranial and facial bones. It braces sides of the skull. It contains pair of sinuses referred to as the sphenoidal sinuses. The wings of the bone extend laterally from the central depression, the bone marking the sella turcica. This is actually a bone marking that will actually house the pituitary gland. The ethmoid bone is anterior to the sphenoid. It forms part of the cranial floor. The medial surface is the eye orbits and the roof and sides of the nasal cavity. Key bone markings here, you have the crista galli. This projects above the superior surface. The cribriform plate holes allow for the olfactory nerves to pass through for smell, and it also contains ethmoidal sinuses. The ethmoid bone markings, we have the superior and middle nasal concha. These project into the nasal cavity toward the nasal septum. This will slow airflow, moisten, and warm the air. This will be a very important process for the respiratory system. The perpendicular plate forms part of the nasal septum. Bones of the face, This is meant to protect and support the entrances to the digestive and respiratory tracts. It's also the sites for attachment of muscles for facial expression and manipulation of food. Only one, the mandible, is actually a movable bone. The maxillary bones, these will articulate with all other facial bones except for the mandible. It's the largest facial bones. It forms the floor and the medial parts of the orbit ribs, the walls of the nasal cavity, and the anterior roof of the mouth, referred to as the bony palate. Key bone markings will include the maxillary sinuses, which will produce mucus that drains into the nasal cavities. It will also lighten the weight of the bones. And infraorbital foramen, which is the opening for the major sensory nerve from the face. The palatine bones and the vomer. The palatine bones form the posterior surface of the bony palate or the hard palate, which is the roof of the mouth. The L-shaped bones also contribute to the floor of the nasal cavity and the floor of each orbit. The vomer articulates with the paired palatine bones, and this supports the partition forming part of the nasal septum. Each zygomatic bone will articulate with the frontal bone and the maxilla, forming the lateral wall of the orbit. The temporal process bone markings of the zygomatic bone forms a zygomatic arch or cheekbone when meeting the zygomatic process of the temporal bone. Nasal bones will form the bridge of the nose between the orbits. They articulate with the frontal and maxillary bones. The lacrimal bones are located within the orbit on the medial surfaces. They articulate with the frontal, ethmoid, and maxillary bones. The inferior nasal concha will project from the lateral walls of the nasal cavity, change in airflow, and deflect air towards the olfactory or smell receptors. Within the nasal complex, we have the paranasal sinuses. This drains into the nasal cavities. And then the nasal septum, which is going to form from the ethmoid bone and the vomer. This will separate right and left portions of the nasal cavity. The mandible, this is the only bone of the lower jaw. Vertical process or ramus on either side extends toward the temporal bone and articulates with the temporal bone at the mandibular fossa. The hyoid bone, this is a small and U-shaped bone. It's not attached to any other bone, and it functions to serve as base for the muscles associated with the larynx, which is the voice box, tongue, and throat. It also supports and stabilizes the larynx. Areas of fibrous connective tissue that have not yet been ossified are what we're going to find in the skulls of infants and children, and they're referred to as soft spots or fontanelles. This allows for easy delivery of the head, meaning that you can actually get the head through the birth canal. If you had a pretty bony structure there, that would be pretty impossible to do. Okay, let's look at the vertebral column. This is also referred to as a spine. It consists of 26 bones. 24 bones of which are vertebrae, the sacrum, and the coccyx, which is referred to as your tailbone. This provides weight-bearing column of support and protection of the spinal column. The cervical region, referred to as a cervical vertebrae, will contain 7 vertebrae, and they're numbered C1 through C7. The thoracic region is you're going to have 12 thoracic vertebrae, T1 through T12. The lumbar region, L1 through L5. The sacral region, which is 5 fused vertebrae from a single sacrum, and then the coccygeal region, which is 3 to 5 fused vertebrae to form the coccyx. And here you can see your vertebral column and the breakdown of the different vertebrae there. If you note, the spinal column actually has 2 spinal curves, or 2 spinal curvatures, or several spinal curvatures. Your primary curvatures, these are present at birth, and these include thoracic and sacral. As you begin to walk and actually stand on 2 feet, the secondary curves develop, and these include your cervical and lumbar curves. All 4 spinal curves should fully develop by the age of 10. Three examples of abnormal spinal curvatures are kyphosis, which is an exaggerated thoracic curvature, lordosis, which is an exaggerated lumbar curvature, and then so kyphosis is hunchback, lordosis is swayback, and scoliosis is an abnormal lateral curve, so you're turning to one side or the other. The first two cervical vertebrae are a little special. C1 is referred to as the atlas, and it holds up the skull. It articulates with the occipital condyles of the occipital bone and allows for specific nodding yes movement. The C2 is the axis. This has a projection up toward the atlas called the dens, or the odontoid process. This allows for rotational shaking of the head, no movement. The thoracic vertebrae, T1 through T12, will actually allow for articulation points referred to as costal facets, which will allow it to articulate with each of the 12 pairs of ribs. L1 through L5, these are your lumbar or lower back. They're much thicker, very large vertebrae. And this is really to deal with the very large amount of weight that's actually put on those particular vertebrae. The sacrum is a triangular shaped bone. It consists of 5 fused vertebrae. It protects organs in the pelvic cavity. It has lateral articulations with the pelvic girdle. Broad surface provides attachment sites for muscles, especially those for leg movements. The sacral canal holds the spinal nerves. The sacral foramen is for spinal nerves as well. The coccyx, this is usually 4 fused vertebrae. Fusion is not complete, until late adulthood, and it may fuse to the sacrum in elderly people. The last part of the axial skeleton is the thoracic cage. It consists of the thoracic vertebrae, the ribs, and the sternum. It forms the walls of the thoracic cavity. It protects the heart, lungs, and internal organs. Ribs and sternum form the rib cage. The ribs, costal bones, these are all classified as flat bones. And here we have our thoracic cage. With the ribs, there are 12 pairs. 10 pairs are connected to the sternum by hyaline cartilage, either directly or indirectly. The first 7 are referred to as true ribs. They connect to the sternum by separate costal cartilages. Ribs 8 through 12 are false ribs because they do not attach directly to the sternum. 8 through 10 are referred to as are ribs whose costal cartilages fuse and merge together with that of the cartilage of rib number 7. The last 2 pairs, 11 and 12, are referred to as floating ribs because they do not actually attach. And the red here or the blue here, this is that cartilage. That's not actually the rib bone. The rib bone is what's in the bone color right here. The sternum is also called the breastbone. It consists of 3 parts that fuse by about the age of 25. You have the broad triangular manubrium. This articulates with the clavicles of the appendicular skeleton, and the cartilages of the first pair of ribs contain shallow indentation referred to as a jugular notch. The elongated body, and then the inferior tip, which is the xiphoid process. This can be broken by impact or strong pressure, such as with incorrect placement of hands during CPR. Okay, and that is it for the axial skeleton and the end of recording number 2. Recording number 3, which will be the last recording, will be the appendicular skeleton.